So the new bivalent vaccine is a combination vaccine, and we use multivalent vaccines. Bi is just means two, so this one has two different proteins in it. These types of combination vaccines are actually very common. The most common one that people probably know very well are influenza vaccines, and influenza vaccines have 3 or 4 different strains of influenza in the one product. We also have polio vaccines and pneumococcal vaccines that have multivalents in them as well. So every year we know that scientists combine activity against a number of the recent strains of influenza, for example, and that is included in the latest vaccine. So this is very similar to what we're doing now with COVID. As you know, last week, Health Canada approved the use of a combination bivalent COVID-19 vaccines. It's approved for use in adults 18 years of age and older, and I'll talk a little bit about that in a minute. So this is a form of combination vaccine that has the spike protein in it, not just for the original Wuhan variant, but also for an Omicron variant. And it is based on the Omicron BA.1. But clinical studies have shown that that BA.1 component of the bivalent vaccine stimulates a very strong immune boost against all of the Omicron strains, including BA.4/5. So that's important. I know the US has approved a bivalent vaccine that includes the BA.4/5, more closely related one. But in Canada, the one that's been approved with all the data that we have is the one that's bivalent with BA.1, and that in the clinical studies has shown to give a really strong increased boost against all of the Omicron subvariants. So I think that's important for us to recognize. And so this version, as I said, was designed against the BA.1, and we know that it is BA.4/5 that we're seeing most commonly now, particularly BA.5, but it's not a dramatically different strain. It's not a new variant. It's not a new variant of concern. It's still within that Omicron, and so we're seeing good protection. So the timing will be based on risk and on the time since your last dose. So first of all, we need to know who are the people most at risk for poor outcomes from COVID-19, and I think this will be no surprise to anybody. We have learned that there are people whose immune systems don't respond as well and decrease faster, and primarily that is people who are immune compromised due to underlying disease or due to the medications they're on, and people of older age. So it includes people being treated for cancer, people with chronic kidney, liver, lung diseases, pregnant people, and those and a number of other disorders and medications, and people over the age of 60, particularly over the age of 80, but we really want to protect people over the age of 60. And NACI recommends, so our National Advisory Committee on Immunization has put out their statement on who should get a fall booster. And it's based on people who've had their vaccine for 6 months or more, had their last dose was 6 months or more. And although there's some leeway there depending on circumstances, but at least 3 months since the last dose. And for some people, and Dr. Bivalent will get into some of those details, we may want to give it prior to 6 months, like if we have a local outbreak, or so that we can do residents of a long-term care facility, for example, all at the same time. The other group that we now need to look at is people who have hybrid immunity that I talked about. And people should wait at least 3 months after having an infection before you get your next booster dose. That allows your immune system to mature and to develop that boost from the infection as well. I think it is also very important to say to people who are not vaccinated, even if you've had an infection, we know you are at higher risk of being reinfected and higher risk of having more severe illness if you're reinfected. So you should be vaccinated on top of having had an infection, whether it was Delta, whether it was in 2020, or whether it was recent from Omicron. Immunization will help develop a stronger, longer-lasting immunity, and you are eligible for your dose 1 today. And I encourage anybody who's not been immunized to go out and get that vaccine now. In terms of the bivalent combination vaccine, the following people will be offered around 6 months. So people, residents of long-term care facilities, assisted living, homebound, and other congregate living settings for seniors, older age adults, age 60 and up, people who are what we've described as clinically extremely vulnerable, and we have 3 groups of those in BC, and particularly those aged 12 and up with an underlying medical condition or disability, adults, people who are First Nations, Métis, or Inuit, or from those communities where infection can have disproportionate consequences, residents of other congregate living settings like migrant workers, shelters, correctional facilities, and everybody else should consider getting this fall booster. And I would say you should think about getting this at the same time as you get your flu shot, because that will give you the best protection as we head into the highest risk period. I will say that some of the long-term care facilities, if you remember, many of the people who are recommended strongly to get this bivalent dose are people who were eligible for a dose 4, a second booster. And when we get to October-ish, that'll be about 5.5 months since we started that 4th dose program. So they'll be rolled into getting that vaccine then. And that, we think, will give the best possible protection for all of us as we're expecting to see a surge of COVID in the November-December timeframe. So as we are beginning this fall respiratory illness season, we need to do so with the best protection we can. If you've just had your booster, it's okay to wait 3 to 6 months to get another one. And I've also encouraged all of those who've received their invitation for a booster, who are young and healthy and haven't got that 3rd dose, to get it now. It will give you that stronger, longer lasting protection through the fall. And I also want to thank everybody. We are here where we are in BC because everybody has stepped up. So many people have done what we've done to protect ourselves, our family, and our communities, and it's made a tremendous difference.